Well, I think that what we see now is a slope, an incessant slope from starting in mid November that has not started to slow down. And despite the Christmas period where people were supposedly not meeting each other and we're not working, we're not in schools, we continue to see a very large number of cases every day and an increasing number of hospitalizations. So it is really putting lots of stress on the healthcare system because many regions have already, their intensive care unit beds are currently pretty full, and this is really quite dramatic.
What exactly are the next steps? Because we are seeing already reports of, Quebec will make announcements, starting tomorrow, and in the coming days, things are looking to be stricter. What is Quebec Public Health and data really telling the government what to do right now?
Well, I'm not the one who is in the ministry and speaking to the minister. So obviously, what we know from the current situation is that despite what people think they do, they have enough contacts for the virus to spread. And so there is insufficient precautions taken by people to prevent the spread of the virus. So in that situation, I think that the government will likely announce stricter measures because apparently the message to reduce the contacts is not applied properly.
Why is it so important at this point where we're at with the data, the rising numbers, to basically put a stop and put a halt on everything and businesses, non-essential, and possibly schools and more, and just telling people to stay where you are?
I think that again, I don't know what the government will announce, and but clearly, the what has been done since mid-November has been insufficient to stop the increase in the epidemic curve. So, what will be the additional measures taken by the government to make it clear that we cannot continue in that direction? The healthcare system cannot take more and more cases in hospitals in intensive care units without severe damage to the other patients who have other conditions require also treatments and who will not be able to have access to intensive care beds because they are full with COVID patients. So there needs to be something additional done by the population to stop that increase.
The idea that we still have no real picture of what the Christmas holidays brought, I think in a lot of people were saying in the next week or 2 weeks, we will really have a sense of what went on during the holidays. So what did that mean in terms of, stopping the spread and flattening the curve, as we would say? If we were to impose measures, what is this timeline going to look like for us to finally get rid of this?
Uh, uh, Normally, when you apply new measures, you know that there's a lag from the time you impose that measure to the time you could measure its impact. Because if you impose a measure, let's say today, people who were infected yesterday or the day before will develop their disease no matter the additional measures. And these people will eventually become symptomatic in 4, 5, 7 days, will then be tested, and the test will become positive and recorded in the data, maybe 10 or 14 days after the implementation of that new measure. So in general, whatever the measure you put in place, you know that there is a lag.
So what does that mean going forward? Because the non-essential businesses, the closure happened really on December 25th, and it seems that we're heading towards stricter measures coming up in the next few days starting. So what we might see as an improvement may really only be come February, is what we might think.
I cannot tell dates. I think that that will be again. I'm not aware of what are the what will be announced tomorrow by the government. And but the question here is really, when schools closed, you could have expected some impact because there were less contacts between younger individuals. But then, after Christmas, there were also more measures put in place to reduce people at work, people in stores, and in all these locations. But we've not seen a substantial decrease in any age group. In fact, we are seeing a small increase in people 20 to 29 who appear to be more frequently infected in the recent days, which may correspond to contacts they have had during the Christmas period. But I think the current situation is not explained by a single age group. The increase is seen in all age groups, even if there is a greater increase in the 20 to 29.
So where does that leave us? How do we sort of tackle each, I guess, age group and get the message across, especially if the kids are not in school and if things are, closed. They have been closed the last couple of weeks. People maybe, like you said, perhaps are not working as much. Where does the first line of defense start?
Well, I think the first line of defense starts with each individual. At the present time, I think we got used with COVID 19, and we think that we are allowed to do a little more than just apply strict measures. We are probably seeing more people than we should if it is restricted only to essential contacts. And all of these contacts spread it in the entire population are sufficient to permit the level of incidence that we are seeing currently. And so there is really a need for everyone in the population to turn down the number of contacts they have, and not believe that no, the contacts I have are safe. This is not the way the virus works. The virus finds ways to go from one individual to the other, and the data are clear. We have currently an increase in the number of cases, and without a drastic change in the behavior in the population, that will continue.
And right now, the data, the numbers are severe enough that it would warrant, merit having, us being at home for a lot longer in a stricter way, right?
At the present time, the Achilles heel is really the intensive care units. These are units that are limited by the healthcare people the staff who could take care of patients. You may have respirators or additional respirators, but if you don't have the expertise that is needed to use properly these machines, that doesn't work. And at the present time, this is really where you have a great number of COVID-19 patients, and this displaces the other patients who need to be admitted to intensive care units after large surgeries for cancer or for other very dangerous conditions. And this is where we currently stand. We are, with so many cases due to COVID-19 that we're about to be able to say to other patients, no, you cannot get access to your treatment because the units are full with COVID-19 patients.